Welcome to the Whole Health Podcast,
where a functional nutritionist and a biological dentist investigate the interconnectedness of your health.
Let's get started.
Welcome back to the Whole Health Podcast. Today, I am so excited to invite an amazing scientist and a friend, Dr. Leslie Douglas. Dr. Douglas has been the principal investigator and laboratory director of DNA ConneXions, as well as the laboratory manager of BioComp Labs, two CliA Certified specialty labs located in Colorado Springs, Colorado. Her background includes extensive work in genetics, biochemistry, microbiology, and immunology. In her role, Dr. Douglas oversees the development and validation of DNA testing for vector-borne illnesses and chronic conditions, contributing to the advancement of integrative and precision medicine diagnostics. Dr. Douglas is currently focused on researching and developing PCR-based diagnostic tests for Lyme disease and tick-borne co-infections, as well as creating a range of molecular-based testing assays. We are so excited to have you here in person. Thank you for traveling all the way from Colorado to be with us.
Absolutely. Happy to be here.
And I know a lot of this stuff is probably going to be new for our listeners. A lot of it might be new for Megan. So as a background, I think I had heard about DNA ConneXions maybe 7 or 8 years ago. And it was really through patients who were coming to ask me about, hey, I've heard that my root canals might be infected. Is that true? And I was like, well, I don't really know how to tell you whether that's a yes or a no, So along came you and we started talking. And I remember calling you to ask, can you explain to me what it is that you do? What is DNA ConneXions? And so maybe we'll start there for our listeners. If you would share with us, what is DNA ConneXions and how do you see the importance of that, the data that you provide for patients?
Well, thanks for having me, both of you. I'm really excited to be here. DNA ConneXions is making the connection between your oral flora, the microbes in your mouth, and your overall health. We look at over 80 organisms on our largest panel, which is called the Comprehensive Oral Test. And it's a PCR-based panel. And while there are, millions of microbes in your mouth, we focus on ones that have links to chronic conditions. So it's not everyone that's looking for an assay such as this. Mm-hmm. It's not everyone that's looking for biological dentistry. Mm-hmm. Typically they're like, I had root canals when I was young and I'm sick and I don't know why, or I had cavitations from extractions and, I'm sick and I've been sick the whole time. So we look at these orally based samples and we run it on our PCR-based comprehensive oral test, 88 organisms encompassing bacteria, viruses, parasites, and fungi. And then we give you a report based on what we find, the overall description of the organism, chronic conditions it's linked to, symptomology that can be expected, symptomology that is not expected. It's a very comprehensive panel, and it's based on, it's predominantly species specific. So another avenue of this is we're not just saying like you have Enterococcus that shouldn't be there, but it could be Enterococcus facialis. So it's very, very species specific targeted therapies.
Okay, so now I have
exactly
so many questions. Okay, yeah. So where to start? Generally, the tests that I've reviewed from DNA ConneXions have come from Dr. Blodgett.
Okay.
We're working on a patient together, and they're normally from probably the endodontic tissue area when you're dealing with a cavitation or root canal, right?
Root canals and bone samples from cavitations, yeah.
Okay. So does DNA ConneXions also look at surface level microbes, or is it always within some sort of site that has been extracted?
Great question. So we have, it takes a second to wrap your head around it. We have this large test, mm-hmm. and we have all these different sampling methods. So he can send us bone, or he can send us what we call oral blood. He can send us cavitational blood, extracted teeth, extracted dental implants. We can also do either site-specific or a full mouth survey. Just, get to know your flora, right? With a product called Superfloss.
Oh, I saw that on your website. Okay.
Yeah, and Superfloss, it's actually a available product but made by Oral-B. We buy it kind of in bulk, and we separate them, and we sterilize them because our kits come with everything needed for collection, packaging, and return shipping. So you can do a site-specific or full-mouth survey with Superfloss, and now we have a new sample type, saliva.
Oh, wow.
Yeah.
So if somebody's concerned about what they can see, surface level, there are options for them to test for that too.
Absolutely.
Yeah. Okay. So then I know a little bit about this, but I know you're going to know a lot about this. And I think it's important. Can you explain to us PCR testing versus other methods of testing for microbes?
Okay. So PCR, it's not new. People know a lot more about it now. It's more familiar after the pandemic. It's called the polymerase chain reaction. So right now in our cells, we are replicating ourselves. We're replicating our DNA in cells, right? In vivo, within. So PCR is a way to copy DNA without cells. It's called in vitro. So you start with a genome, right? We're going to talk about Lyme, so let's talk about Borrelia burgdorferi, okay? You start with a genome. That genome is about 1 million base pairs, which you think, wow, that's really big, but it's not. It's super tiny, right? Okay, so you target a specific region, and it's like a front and a back, and those are primers. It's like your beginning and your end. And with PCR, you add these primers that targets your area. You add enzyme, you add the building blocks of DNA, which are nucleotides, and then you thermal cycle it. So you separate the DNA at like 65 degrees. And then you get the stop and start, the primers to sit down. So you lower the temperature. Then you raise the temperature to 72 to incorporate and make DNA. It's amazing.
Wild.
Yeah, it's absolutely amazing. This scientist named Terry Mullis, he conceptualized PCR in the 70s in his, I think it was a VW Beetle, driving down the Pacific Coast Highway.
Wow.
And he went into wherever he was and with a Bunsen burner, and he would go hot, cold, hot, cold. And then he could literally, like, if you have enough DNA, you can see it. So, I mean, that's how it started. Wow. So it is a target-specific amplification. So let's say you're looking for the organism that causes Lyme disease, right? And you add all these ingredients, follow the protocol, and you get an amplification, a product, a DNA, like in a cup, right? So that means the organism was there. Okay. If there is no amplification, organism not present.
Dead or alive, could you be picking up on dead organism, or does it always mean it was live at the time of the sample?
Great question. I get this one a lot. So back to Burgdorferi, the genome is 1 million base pairs. We target in our Lyme disease test, we target between 200 and 1,200 base pairs out of 1 million, okay? So we get a sample, like a urine sample or a tooth sample, to look for the agent that causes Lyme disease. First, we rinse it and we wash it and we clean it. And then we pop open all the cells and we extract it. And then we are so targeted, and it's such a tiny, like, 1,000 out of 1 million. If it was degraded or sloughed off DNA, which we have already washed away because we're targeting only live cellular material, it's statistically unlikely that the 249 base pairs that we're targeting is actually left in that degraded DNA. So is it theoretically possible? Yes, but with our protocols and our checks and balances, it's highly unlikely.
Okay. So because I have
endless
questions,
right,
questions, I'm going to breathe in case you have questions
that's
before
fair.
I go back to my questions.
Well, and I'm always like the big picture thinker
Yes.
here, and bringing this all back to relevance, that, how, going back to how and why we connected, the question that was posed to me of, is it safe to have root canals, particularly over a period of time? Because if, the theoretical of, well, when we do a root canal, the tooth is sterilized or sanitized or whatever you want to call it. Yet we understand that the dentin of teeth, the entire root system is porous like a sponge. Yeah. I mean, it dawned on me probably a decade ago. Like I literally woke up at 2:30 in the morning and had this vision in my head of like, I wonder what's the diameter of the average microbe that lives under the gums, and what's the average diameter of a dentinal tubule, the pore that's in the root of the tooth. So at 2:30 in the morning, I hopped up, went out, got my iPad and looked this up, and I'm like, turns out this is like a car going through a huge tunnel. They're on average 5 to 10%, the microbes, 5 to 10% the diameter of the tubules. So it made sense to me that, well, of course they would, populate the root over time. Mm-hmm. And that's what you've helped me as a clinician validate for people. I mean, I think my wife sent you an email recently to ask how many hundreds of roots have we sent in, and you sent us back the number. And I thought, wow, like of all those hundreds of roots we've sent to you, we've yet to have one that came back free of microbes. And that's sitting in living human jawbone. There's no way that your immune system will not have a reaction to that entity. I'm getting on my soapbox, of course, here, but I think it's so important because the information that DNA ConneXions through you are able to provide to me as a clinician now is to go back to the patient and say, okay, if you're still struggling, like I just had a patient you saw yesterday, I think. And it's so helpful for us to know, well, this is the complex of microbes that your jawbone's been exposed to. If we're considering some anti-whatever, fungal, bacterial, whatever, protocols, now we have a very good sense of what would be more helpful than others because of looking through that lens. So I think it's the clinical implications and significance is so amazing.
Absolutely. So can I say that, as I told you earlier, Dr. Blodgett and I met this morning with 2 other clinicians to review a case that we're all working on, and we were looking at the DNA ConneXions. And before we got on that call, I thought, well, this kid has developed, since infections and cavitations over 3 years, severe autoimmune thyroiditis with no thyroid symptoms, but massive inflammation in his neck. So I was looking at the DNA ConneXions and I was going through each of the microbes, and one of the microbes that pops out to me is a parasite. So I jump onto PubMed and I put in the parasite name and type my big and then, thyroiditis and see what happens, right? And right pops up in front of me, autoimmune conditions with this specific parasite. So what I am interested in learning from you is, yes, we're seeing this localized potential infection or infected area. Mm-hmm. Dr. Blodgett's amazing and gets all the infection out from that local site. But we have not only tubules and dentin, we have capillaries. We have all sorts of other highway systems for these microbes to move. So can you talk a little bit about systemic infection? And also, are these microbes coming from the body and hanging out in these sites? Are they hanging out in these sites and then moving to the rest of the body? What is happening? What are we supposed to be thinking about as clinicians?
Yeah, it's all of the above. People have their main natural flora, okay? Some are more robust than others. I have a great story about that. Some are more robust than others. But they say, well, okay, so I saw Dr. Blodgett and he did clean up all my infection, but this was in my mouth. Does that mean it's in my body, right? So some people are going to tolerate general dentistry, as you're, I guess, taught in dental school, no problem. They can have a mouthful of mercury, no symptoms ever, right? A whole mouthful of root canals, right? And then there's some people that what I tell them is, a root canal tooth, which is, I guess, by some considered the standard of care, dead is dead, right? It's going to entertain your immune system. Okay, there's no way that you're not going to have inflammation around this, dead plastic rubber packed site in your mouth. And if your immune system is being entertained by this, then it's not paying attention to what it really needs to be paying attention to. So that combined with what's in your normal oral flora, what are you continually exposed to, what other things in your bodies, like artificial parts, pins, even different restorations, we're going to talk about BioComp in a while, is entertaining your immune system so that it's not focusing on what it needs to be focused on, which is the systemic release of those organisms and the overall chronic conditions that they are the root cause of. So it's all of the above. It's everything from the beginning to your end, from your mouth to your bottom, everything.
So if somebody has their oral infections dealt with to the best of our knowledge and ability, and they're still symptomatic for whatever they may be originally concerned about, are you then thinking go and test for these microbes throughout your body in whatever way we're able to? Are you thinking that is either the biotoxin from the microbes or the microbes themselves causing the activation of the immune system? Would that be our next step?
Yeah, that would be one of them. Absolutely. And then, a lot of times, we'll get a positive panel. I mean, you've seen the DNA results. And so, I say like light up like a Christmas tree, like the whole thing is red, right? But they're like, I'm completely healthy. I had like one cavity in my whole life. I'm completely healthy. And it's like, well, maybe you just have a really robust flora, but it's always something to keep in the back of your mind. If you have, in the future, unexplained symptomology, like maybe it's commensal now, right? Like you live with them, they live with you, everybody is kind of quote happy, but then you get some other condition like, a really bad flu or like a COVID or, all of a sudden you're starting to react to dentistry. And then the symptomology just goes crazy. You're like, oh yeah, I did that ConneXions, a couple of years ago. I have to look at my flora.
I think that's one of the things that's hard for a lot of patients to swallow, this fact that they can be fine for a really long time and have an event, get an illness, have an injury, a concussion, a car accident, a very stressful period of time in their life that rocks their immune system out of balance or shifts something. And then all of a sudden, these things that they were functioning with just fine are now really problematic.
One thing so question here for clarifications, and I've been thinking about this for a while and been meaning to send you a text and ask. So I've talked with people who, let's say they do a super floss test. Okay. And they use the super floss around a root canal treated tooth. My understanding is, well, of course, you're going to have microbes in the mouth. We expect that, to your point, from the mouth to the bottom. The whole thing we expect to have microbes should be. Would you say that information of a super floss test, does that correlate to the level of biological burden of the tooth, in this case, a root canal treated tooth in question?
Again, like, yes and no. We are assaulted from the moment we're born. And, we have a metallic load, we have a microbial load, we have a biotoxin load. So we offer at DNA ConneXions the largest, most comprehensive oral test out there, 88 microorganisms. It's only a drop in the bucket. We in the research and development of the panel, there was a lot of thought into which organisms should be there, which ones need to be there, which ones are, normal commensals of the mouth, but some people can't tolerate them. So, there was a lot of thought put into that. You have to keep in mind that while we do have the largest test available, it's minimal compared to what's actually in our mouths. It's minimal.
So, and how long has DNA ConneXions been around doing what you're doing?
Oh gosh, at least 30 years.
Wow.
It was opened by a biological dentist named Hal Huggins. And he has since passed away. He passed away in 2014. I never actually got to meet him. I came on board in 2015, right when our current owner, Dr. Blanche Gruby, bought the company and then rebranded. It used to be Dental DNA, and now it's DNA ConneXions.
Gotcha.
Yeah, because now we've branched out and we focus on more than just the oral cavity.
Mm-hmm. Go ahead.
So oftentimes, whether the patient starts with Kelly or starts with me, there's some level of complex chronic disease that we're trying to get to the root of,
cause.
right? Root cause. So can I ask you about Lyme because it comes up so much?
Absolutely.
Okay. So I feel like the argument in the professional space, the provider space, is all about testing methodology. And no matter what test you choose, another provider is going to tell you why that test doesn't work and you can't trust it. And if Western blot isn't positive, then they don't have Lyme. And, we all know that's crazy. But it is hard to know what test to use. Methodology matters when you're looking for these microbes because some of them behave very oddly, once they're in the human body. So can you tell us about the Lyme test that you offer and tell us a little bit about why it's superior to other tests?
So Lyme disease is caused by a bacteria. It's called Borrelia burgdorferi. And if you, and it's transmitted by a tick. So I can tell you, I'd never live on the East Coast. And if I did, I'd never have a dog. Absolutely not. I don't have personal experience with Lyme disease, but I have been obviously working with it with patients and practitioners for 10 years now. So if you are bit by a tick and the tick transmits this bacteria, what they call a blood meal, by attachment, there's over 40% chance that tick is going to co-transmit other bacteria and actually other parasites. And so that's why Lyme is so tricky. It's because is it Borrelia burgdorferi, the causative agent of Lyme, or is it Bartonella? Or is it Babesia? Those are what we call those co-infectors. So just like the comprehensive oral test, we have a Lyme disease test. And what makes us different is it's not immunologically based. We are looking, just like oral, for the DNA of the organism that we're targeting. We're not going to say you have Lyme disease. We're going to say we detected the DNA of the organism that causes Lyme. There's a big difference there. So they say that the gold standard, in quotes, of testing for Lyme is immunologically based testing, like a Western blot. And we're the new kids on the block, but because we don't agree with that. So these organisms are very tricky. Once you have a tick attached, and they are transmitted, there is a process called dissemination where the organism's in the bloodstream and it circulates out the whole body and it goes to your blood and your tissue and your organs and it hides everywhere. This organism, all of them and the co-infectors, they all have overlapping symptomology. So you don't really know until you know on the species-specific level, you don't know which one is causing it or if multiple. That it's a multiple organismal infection that's causing all this vague and diffuse symptomology. So immunologically based testing, which is your ELISA and your Western blot, that's not what we do. I explain it to people in this way. I say, when I was little, I had the chicken pox. And my body mounted an immunological defense in the format of antibodies, and I fought it off. And then your body remembers, right? So if you tested me today for the antibodies for the virus that causes chickenpox, I would be positive. But I'm not positive today. I don't have it. It's just my body's memory of me having it when I was little. So what does that tell you? That means that you were infected and your body mounted an immunological defense. Not very helpful today when I don't feel well, right?
Right.
So now DNA ConneXions comes along and we say, okay, we're going to look for the DNA of the organism. Okay, so Leslie's positive for Borrelia burgdorferi, the agent that causes Lyme disease. Leslie is positive for Bartonella henselae, right? Leslie is positive for Borrelia miyamotoi, which is really common on the West Coast. So it's not just you've been exposed. It's we detected the DNA of this organism in your sample. So then, let's say Leslie's mom says, oh, I live with Leslie, like when I was younger, right? So she gets tested. Leslie is very sick, but Leslie's mom harbors the organisms, coincidentally, and is not sick at all. Again, just like the oral test, it's something to keep in the back of your mind because like you said, stress, car accident, chronic condition, the mother may be tolerating it a lot better because we get a lot of family testing. The mother may be tolerating it until she's not.
Yeah.
So like I said, some people just have a robust oral flora. Some people, they get bit by a tick, they contract these organisms, their body fights it off, they never even know that they had it. Whereas some people, they get bit by a tick and it's like they've been run over by a bus in 2 days.
Yeah.
And then some people, the third group, they're bit by a tick. They contract these organisms. Maybe they get a little sick. They feel like they have a flu. And then, like I said, it's a balance. They're commensal until that balance is thrown off. So, and it's, the symptomology is so diffuse. The organisms are, so many. We have a large panel that has 10 organisms on it. And again, just like oral, it's kind of a drop in the bucket.
Right.
So, I mean, it's such a rewarding thing to work on, but it's really hard. Yeah.
And the Lyme test you offer, is that blood?
It is urine.
It's urine. Okay.
Actually.
Okay.
So the urinary tract is what they call a site of spirochetal persistence. Bacteria have different shapes.
Yeah.
And a spirochete is a corkscrew kind of shape. And that's what Borrelia burgdorferi is. So
higher likelihood that you'll find it there versus taking a sample of something else then.
Well, so the organisms, after they go through that process of dissemination where they travel, around our bodies and our bloodstream, they leave the bloodstream. So while the antibody test would, people call me and they're like, I was tested for Lyme. And I'm like, okay, was it a blood test?
Right.
And they go, yeah. And I go, oh, so it was probably a Western blot. And they go, oh, yeah. And then I go into, well, when I was little, I had the chicken pox. So what does that result tell you?
Yeah.
That's why they want to know, like, why are you different?
Yeah.
Yeah.
So really only in a blood test, if you see a positive IgM, you might think this is happening. But an IgG and IgA could be past infection, really.
Absolutely.
Yeah. Okay.
Absolutely.
Well, I want to provide the information for the listener to understand. So when we first started working together, we were doing oral panels only.
Yeah.
And then as I started observing patient histories and their symptoms and descriptions and such, and came to understand you were offering the Lyme test as well. And then we started talking about, well, if I'm going to send a sample, let's just assess of everything we can understand, what's the picture? And it is intriguing to me based on what you just described. Like, if it's a positive, it's there. And we're sending you roots cut off at the bone level, so only what is below the gum tissue and in the bone, and bone samples that we send you. And I would say it's probably about 90% of the samples that we send you have live Lyme microbes or Lyme-associated microbes in these samples, which from a general health perspective, I think is really helpful or it's important for people to understand that when we're talking about risk and why DNA ConneXions through the oral panel report, the Lyme report, why that's so helpful is it gives people like Megan and me the opportunity to understand you've had this exposure, it presents risk. It's not definitive of Lyme disease per se, but it is so helpful for us to understand you've had that exposure and then decide, well, how then do we want as clinicians to help your body's immune system, up level your nutrition, whatever we're doing.
Yeah, certainly. And I think about too, so many of the microbes that we used to brush off in a lot of ways now are being connected to things like multiple sclerosis, Alzheimer's disease. I mean, I could go on and on and on with the list of things that were like, bummer, you have this disease that's going to ruin your quality of life and then you're going to die, right? And now we're seeing, there's a microbial connection here. So for me, identifying these things early before there's really severe symptoms, or when there are symptoms that seem like they're idiopathic or we don't know the cause, and we start to see, there is a connection between these microbes and your arthritis. There's a connection between these microbes and your whatever else. That's really powerful because we have a place to start.
Yes.
With treatment and supporting the body to deal with now what we know is a trigger or a pressure on the system.
Yeah. It's not just in your mouth. It's about your whole body.
Yeah.
Whole body health. Absolutely.
That being considered, I am curious, who are the primary senders of samples to you? Is it physicians? Is it lay people wanting their own information?
Well, obviously extracted teeth and, removed dental implants, that's from practitioners. I don't recommend that as a home test. It's kind of both. I should have a number, but I don't. I would say that probably more practitioners, because practitioners have a bigger reach. But I would say maybe like 70-30. So all of our tests can be ordered as a patient request. So we get people all the time, calling up saying, "Oh, I just heard about you. I want it." Or I just saw some old video with Dr. Huggins, and what could you do? What could your test help me? I had a gal just actually a couple of weeks ago, chronic halitosis. Only complaint. That's her only complaint, and she doesn't have a lot of dental work and she doesn't have periodontitis. And she calls me and she goes, "Is there anything that you can, I've given up. Is there anything that you can do?" And I said, it's worth it. Let's do a comprehensive oral test and see what we find. So she calls me back up. She goes, "Okay, I have my results. What do I do? What do you see here?" And, I'm looking at it and there's a lot of red. I mean, our average for those 88 organisms, our average that we see is between 12 and 17. The most robust sample types are superfloss and extracted root canal teeth. That's where we see a lot. She was a little above average. And then I'm looking at the organisms and I'm talking about symptomology and I go, "That's interesting. Capnocytophaga ocracea. I don't see that a lot. I've seen it, but I don't see it a lot." And just like you, go to PubMed. I'm like, Capnocytophaga ocracea and halitosis. Huge connection.
Crazy.
Huge connection. She goes, "Well, what do I do now?" I go, "Well, now you go talk to your doctor. I'm the lab. I found it. Here's the connection. Take, find some, go to your integrative practitioner and get this one organism under control. And then let me know how it goes."
Wild.
She was crying. She was
Wild.
crying. So something as simple as that, all the way to gut issues, cardiac issues, reproductive issues, it's all related.
Wow.
So for people who are listening, one, where can they learn more about DNA ConneXions? And two, if somebody were interested in doing an oral and Lyme panel, approximately what would they imagine investing?
So DNA ConneXions is, we're located in beautiful Colorado Springs, Colorado. And we're online, DNAConneXions.com, and it's with an X. So it's DNA ConneXions. X as an X-ray, IONS.com. All of our tests all the information, it's all there on our website. A typical oral test, if you are ordering, say, a superfloss test, that is $680. I'm sorry, that is $480. Sorry. Mm-hmm. Oral test, $480. I don't really deal with that part. I made sure to review it before I came in. It's okay. Oral test is $480. At-home sampling is your superfloss or your saliva. I really like the superfloss. It's thick, not as thick as a pipe cleaner, but it's a little furry and thick. Mm-hmm. You can get it through your teeth. You order the kit, it comes directly to your door. It has everything, comprehensive instructions. You wash your hands, you floss your teeth, you put it in our sterile plasticware, you package it up, and you ship it back. Everything is included, including the prepaid return shipping via UPS. A Lyme panel, which you can do the urine sample, which we view as the comprehensive body sample, or you can do a superfloss, which is a more site-specific in the oral cavity. That one is $680. Again, we send the kit to you. You take your sample at home. Dr. Blodgett and I have done a lot of studies, and also Dr. Berkmeyer in Michigan, I think that's where she is. We've done a lot of comparison studies of teeth and urine. So he'll send me the tooth sample to run, and I'll say, okay, well, I'll have them also provide this other sample for comparison. Mm-hmm. And while we say urine is more comprehensive body, and the mouth is more site-specific, they really align, don't you think, Doc? Mm-hmm.
Yeah.
Those results really align.
Well, another fun one we did recently, which, I became curious looking at this poor young lady's mouth. She had a root canal tooth that had broken off at the gum line, and the bone around the roots had become like so dense and sclerotic, or, dead-ish. And I thought, let's test the roots because we're curious what's in here because of her health symptoms. But I also thought, why don't I resect this bone? It's unhealthy anyways, and send the bone in. And 80% of the microbes that were in that bone sample were also in the root. Sure. And I was like, wow, this is, because the argument in the root canal community is, hey, it has, this is what they say, there's no validated scientific evidence that root canals cause systemic harm. Yet we're sending in bone that is clearly infected. So I think there's more to come in that arena, and I know you all will be playing a part in that to help us understand more about what is getting into our jawbones and therefore our lymphatics and our cardiovascular system and presenting risk. Yeah. So, well, this has been awesome. We could go on for hours, I'm sure, but I want to make sure we save enough time for our next conversation. So for our listeners, we will be interviewing Dr. Leslie Douglas again on the issue of dental materials and biocompatibility. So I'm super thrilled to talk about that. I thank you so much for being with us here on the Whole Health Podcast. And it's been a really awesome talk, very enlightening.
This is great. We just scratched the surface. Yeah. So go to our website, and I'm always there to talk with anyone that cares to ask me questions.
Sounds like you're going to be getting a lot of calls from me.
Thank you so much.
Thank you.
Thanks so much for tuning in to the Whole Health Podcast.
If you enjoyed what you heard today, please follow us on social media and wherever you listen to podcasts.
You can find out more about us at thewholehealthpodcast.com.
You can find me on my website, blodgettdentalcare.com.
And you can find me at bioloungepdx.com or learn more about my organic soluble fiber supplement, Fluorosophy, at thinkfluorosophy.com.
We look forward to seeing you next time.